Welcome back to my channel. My name is Deanna Tikhonov and I'm a women's health nurse practitioner. And on today's episode, I'm going to be talking about PCOS or Polycystic Ovarian Syndrome. This is something that I'm sure you watching out there may have been told you have it, may have it, know someone who has it, or has read something about this. And I'm here to kind of break down what it is, what it means, what you can do about it, and how you could potentially cure yourself completely of PCOS. So if you like my channel and you're here now visiting, make sure to give me a thumbs up right down below, subscribe, and make sure to click the bell so you're notified of new videos each week on Sundays. So I'm going to be talking first about what is PCOS. So PCOS is something that tends to look like where women will stop getting a period, sometimes months at a time. Usually anytime a woman goes more than 2 to 3 months without a period, very often it is a little bit of a red flag of what could be going on and may indicate that a woman has PCOS. So it's important that you're always tracking your periods, and if you find that you're starting to skip months at a time, it would definitely be a good idea to go check in with your provider and sometimes do blood work or an ultrasound. Sometimes they just go off of your history to kind of determine if PCOS could be a diagnosis for you. So usually it's infrequent periods. However, some women have the opposite, where they actually have very heavy periods that are happening very frequently. So PCOS doesn't always follow a textbook scenario. So another reason why it's important to check in with your provider if you find that you just feel like something is off. Other thing that tends to go with PCOS is a lot of excessive facial hair or acne along the jawline area is something that can happen. Now, some women don't have this at all and sometimes think, oh, well, then I can't have PCOS. And the thing with PCOS is it's kind of called what we call a diagnosis of exclusion, meaning we check for other things that could be causing your symptoms, and if all of the tests come back normal and things are kind of pointing to PCOS, then that is how we give you that diagnosis. So infrequent periods, but sometimes heavy or excessive bleeding, and or facial hair with acne, a lot of facial hair and acne along the jawline area. The third thing that we look at is if your ovaries have teeny tiny little cyst or polycystic ovaries. Now, a woman can have the first two symptoms, infrequent periods or heavy periods often, and the acne on the face and excessive facial hair without polycystic ovaries, and we can still diagnose you as with polycystic ovarian syndrome. So it's a little tricky. Most OBGYN providers out there follow the Rotterdam criteria, which means that if you have 2 of the 3 criteria that I just mentioned, that is enough to diagnose a woman with PCOS. So don't get too caught up if you have polycystic ovaries or you don't, because that is not the end-all be-all to diagnose PCOS. So that's kind of what it looks like in a nutshell. And this is something that can affect all women of different ages for sure. But now what can you do about it? You've been told you have this, and now what? Now, PCOS is associated with the potential downside of having more difficulty getting pregnant in the future. But it does not at all mean that you cannot get pregnant. I can't tell you how many times I have women in shock that they got pregnant because they truly were told that they could never get pregnant because they have PCOS. Not true, not true. So it's really important that if you have been told you have PCOS and you're not planning a pregnancy, make sure you're using birth control, because it can happen. Anything's possible. So, but it can make it more challenging. And one of the things that I see most often in practice when I'm getting patients from different offices is birth control is usually what is prescribed to kind of help manage the PCOS. And yes, it is helping to regulate your periods, which kind of gives most women some sanity. So if you're falling into the category of not having a period often, or you're having really heavy periods, having birth control to kind of help level that out and regulate your cycles is very helpful if you just need that peace of mind and to not be worrying all the time of if you need a pad or not, or what's going on, are you pregnant or not. So that's why birth control is so often used for regulating your cycles. but it's not actually treating PCOS. It's not making it any better. It's not treating the underlying issue. So the main treatment for PCOS that has known to fully reverse it is weight loss, diet, and exercise. The three things that we all kind of know are good for us, but it requires habit changes, and commitment on your end to really do the work. And that's where I see that it becomes a struggle, because I know a lot of you out there, it could be challenging to go and change your life and make different lifestyle habits. It's making little baby steps, because being told, oh, you need to lose weight, I understand, could be very intimidating, of like, well, where do I start? How do I do this? But it is known to help reduce the PCOS going on and completely erase it so that it's no longer an issue. I have women that have grown out of PCOS or cured themselves because of the lifestyle changes that they made. And I know it's not as easy as saying, here's a pill that's just going to make it all go away. It does require work on your end, but it's amazing to know that you have the power to reverse something that is going on in your body and regulate your cycles again, improve your chances of fertility in the future, and overall feel good, be healthier. So it's kind of a no-brainer, but I understand it's a shift to look at your life of what habits maybe need to be tweaked and changed to help improve weight loss, healthy diet. When I say diet, I don't mean restrictive diets where you're cutting out large food groups and you're eating minimal meals throughout the day. That's actually usually makes things worse. So you want to make sure you're eating small, frequent meals throughout the day to keep your metabolism at a steady, regular rate. When you're skipping meals and going long periods of time without meals, your metabolism slows and it kind of screws things up in your body, thinking that it needs to go into starvation mode and store the fat rather than burn it off. And that could kind of lead to a bad cycle. So it's very important that you are eating small, frequent meals throughout the day. I always recommend trying to do home cooked meals rather than eating out. When you're eating out, you don't have control over what's going in your food, how much salt is in it, how processed it is, if it's fried. All of those things impact it. And usually the portions at restaurants are way larger than what we're supposed to be getting. So really small, frequent meals is the best way to go. Making most of your liquids water. When you're having things like soda, juice, alcohol, all of that converts into sugar, which then converts to fat, and that can definitely play a role with PCOS as well. So sticking with water, making most of your meals with a lot of fruits, vegetables, whole grains. If you eat meat or fish, making sure it's lean and baked rather than fried. All those little steps go a long way. It's not going to be an overnight thing, but it is something that with time, it will continue to get better. It will help improve your chances of weight loss in conjunction with exercise, of course, and starting small. You know, if exercise seems to be something that's really difficult to fit in with your life, making a goal of starting 15-20 minutes once a week. You know, starting in baby steps I find is much better. It's less intimidating, and with time you're gonna feel good. No one ever regrets doing a workout. They always feel better. So that feel good feeling, the hope is that once you feel that, you want to continue with it and keep doing it to incorporate that into your lifestyle, and then that will in return cause weight loss. So that is really the way to help cure you of PCOS. It's all the medicines in the world are not going to take PCOS away if we don't change your lifestyle and try to make it healthier. So I hope that this video was informative for you. Please make sure to send it to friends, family. Don't forget to give me a thumbs up if you watch my video, and subscribe to my channel. Make sure to press the bell so that you get the notification of my next video. Thank you so much for watching, and I look forward to seeing you in my next video.